Welcome to another special edition of Kibbe on Liberty, COVID edition. We are still using Skype and we are still remote, but we are going to dig into data today. I never thought I would do a show about this. I always aspired to do music and comedy, but I feel like we all need to understand what's going on with these estimates about the impact of various COVID scenarios. And I'm going to argue that economists and econometrics and assumptions, these are the things that are actually going to determine how we best deal with all of these problems. And I brought on a friend and an economic historian, Phillip Magness. Hey, Phil, how's it going?
Hey, doing great.
You in virtual lockdown in Virginia, your governor has mandated some pretty draconian things.
Yeah, extended it through, I think June 10th is now our date when we can go back outside again, pending any reversal in his decision.
Yeah, and I'm wondering how all of this is determined, what is essential and what's not, and who decides. But there is a threat in Virginia, which I'm not sure I've seen elsewhere, but I'm sure it's out there, that violating the governor's mandate could get you a year in federal prison, not state prison, I guess. I don't know.
Right. Yeah, with discretionary power handed over to the police in an indeterminate timeline. Perfect combination.
So our mayor has decided that I will be locked down, subject to similar restrictions tomorrow. I barely knew what her name was until she told me that I wasn't allowed to leave my house. But I go off on a tangent. Why don't you tell everybody, you're a senior research fellow with the American Institute for Economic Research. I'm a big fan of the work that you guys have been doing since day one, but particularly during this crisis. Tell us a little bit about what you do there and what your background is.
Yeah, so my general background is I'm an economic historian, and I work mostly on tax policy. Both the 19th and 20th century, some of the relation of that between taxation and the inequality debate, do a lot of number crunching in that, some higher education policy, and then just general historical themes. But, as we've seen in the last few months, quite a few of these topics have been set aside as we've migrated over into addressing the current crisis. So AIER, where I work, has been trying to enter into this debate by offering a tempered analysis of everything from data to consideration of what the policy responses are, unanticipated consequences of some of the decisions that we're making on what seems to be a very hasty basis, and trying to get that information out there so we can have a rational discussion of everything that we're facing instead of this normal atmosphere of media hype that seems to be.
Yeah, I think it does seem like a number of our public officials, and I think what's his name, Anthony Fauci. Yeah. What is his title? Do you remember? Do you remember?
I don't recall at the top of my head. Basically, he's the number 2 guy in the government at the CDC for addressing this type of.
Yeah, and he seems to want people to be afraid, and I think concern and responsible behavior and all of this is very much required at this time. But it seems like fear can lead to some fairly irrational outcomes in terms of policies, in terms of personal behavior. And I think we need to kind of stay calm and chill out and have a little bit of humility right now instead of everybody freaking out. But that doesn't seem to be. I don't hear a lot of reason coming from our public officials right now.
Right. Quite the opposite. It seems like, I called this in a conversation with a colleague the other day, basically a race to the bottom of all the different governors and mayors and county officials to see who can get the most extreme version of a policy into place. So it'll be Governor of New York announces that we're going to be shut through April 15th. And then the next state over, it says, no, we're going to do April 30th. And then yesterday we got Ralph Northam announced, well, I'm going to push it all the way to June 10th. So it's a succession of more and more extreme policies where they almost seem like they're trying to outdo each other.
Yeah. And you've written, I've been following you on Facebook, and you've written about sort of the perverse incentives for political actors and bureaucratic actors, some basic public choice analysis that that argues that doing more is safer than doing what is appropriate, because then you can't get blamed because you didn't do enough.
Right, right. So it's the incentive is almost there to intentionally overstate the severity of any claim, and we see this in most natural crisis type situations. So I liken it to whenever there's a hurricane in the Gulf of Mexico that's coming toward one of the major metropolitan areas around there. The impulse of policymakers is to always go for the more extreme solution. It's to say we need to lock down mass areas of the coast, mass evacuations that aren't always in sync with what the actual forecast of the hurricane happens to be doing. Yet county officials and city officials will tend to adopt this type of a policy because the alternative scenario, if they underprepare, if they underestimate what it's going to do, you get Hurricane Katrina 2.0. So no one wants to be in that situation as a public official. What they do want to do is be seen as acting, be seen as preempting some of the problems that could happen in a worst case scenario. Whether or not that's a realistic assessment is often set aside to rather the impulse to act itself.
And you're seeing, I don't want to go down a political rabbit hole, but you're seeing the governor of New York, who's now ubiquitous on TV, and
Right.
perhaps certainly one of the leaders in terms of draconian lockdowns. He's now being talked about as a potential replacement for Joe Biden as Democratic nominee for president. So clearly, politically, the incentives seem to work.
Just to be seen as doing something, and that's a whole. Consider this is an entirely different question from actually being effective at doing something. A politician in a time of crisis wants to be in front of the camera, making proclamations that they give the general appearance to the public that this is under control or this is something we're adapting toward or preparing for. And unfortunately, it seems that this type of behavior resonates with quite a few people.
Yeah, and I don't want to pick on Governor Cuomo, because as far as I can tell, he seems to authentically want to do the right thing. And your colleague Jeffrey Tucker found some pretty amazingly honest comments made by Governor Cuomo. And I talked about this with Congressman Massey. Government Cuomo expressed what I would call the precautionary principle when he said, if all of this shutdown and all of the economic damage caused by this shutdown in New York, if we just save one life, this is all worth it. And
Right.
that sounds pretty good. But then he goes on to say, and I highly recommend everyone read this in various news conferences. He said, look, I'm not sure I know what I'm doing. I'm in hindsight, shutting down the schools was probably the exact opposite thing to do. And we probably hurt people, caused additional mortality by putting kids with their grandparents, because where do kids go when they can't go to school? They got to go somewhere. And so he's at least acknowledging that there are these trade-offs, and it's not lives versus economics, it's lives versus lives. And every action has an intended consequence, an unintended consequence. And certainly our ability to feed ourselves and our ability to shelter at home safely, everyone has a very different circumstances. All these things matter. And at least he's acknowledging, when he's speaking candidly, that he doesn't know what he's doing. He's just trying to do something.
Yeah, yeah. And this cuts back to, I think, a deeper economic insight. I keep thinking to Frederic Hayek, and this is a familiar quote I'm paraphrasing here. But he wrote in this great little book called The Fatal Conceit. He says the curious task of economics is basically to convince people how little they know about what they imagine they can design. And I see this playing out over and over again with governors, mayors, city councils, even all the way up to the president of the United States. There's a propensity to project that you are in control, that you do have the knowledge to navigate this crisis if only we enact the exact levers that we think are going to mitigate different steps of its evolution. So if we go on lockdown this week and then we tighten the lockdown next week, or then maybe before that we had implemented a social distancing policy in public places, that this is going to yield predictable, discernible results that get us to a point of disease mitigation that we'd like to be at. So it's perfectly well intentioned. But the problem here is there are vast levels of uncertainty underlying all of these decisions, to the point that when you're actually making some of these projections, the very announcement of the projection itself induces people to change their behavior, their response to it. So the result that you were anticipating in the model is in some ways already invalid before the policy itself comes into place.
Yeah, and in one of your posts, I think it was the threat of the Rhode Island governor to
Right.
shut the border with New York. The very threat of doing that induced people to do things that they might not otherwise have done, which may have in fact spread infection as opposed to containing it. Explain.
Yeah, exactly. So suppose you live in Rhode Island, or even more importantly, suppose you live somewhere in the I-95 corridor, which means you have to drive through Rhode Island to get from, say, Boston to New York, or vice versa. So this is a major freeway that goes through this very small state, where the governor announced that basically she was going to put checkpoints at the different borders on 95, where you have to pull off in the rest station and register with the state police if you have an out-of-state license plate. And if you were intending to stay in Rhode Island, you'd go into quarantine even. So this is intended to be a policy to mitigate and prevent the transfer of disease from this hotbed area of New York City further up the coast. So perfectly well-intentioned, at least as they presented it. But if you think about some of the consequences of a policy like this, you announce that you're going to put an entire state under a situation of closed borders and a lockdown associated with that. What happens if you are a resident of Rhode Island, or you are a resident who has another home somewhere along that corridor that has to pass through Rhode Island? Well, maybe you would have previously been considering sheltering in place, but now you have the situation where maybe for an indefinite time in the future, or several months, you're not going to be able to travel. So what do? You throw all the bags in the back of your car and head on up the freeway before the lockdown takes place, before the border restrictions come into place. And we see this over and over again with states that have announced this policy. So Florida is another one where the governor has said they want to restrict travel from people that are coming from states in the Northeast that are seeking refuge from this epidemic. Well, quite a few people in the Northeast have second homes or vacation homes down in Florida. So you make an announcement that, hey, Florida is going to be cut off to anyone from New York City for the indefinite future, and you're living in New York City, and maybe you were going to ride it out up there. Now, all of a sudden, it becomes a decision. Do I hop in my car and try to get to Florida, which is less affected, less restricted at the moment than New York, to beat this lockdown? And in the process, you end up moving more people around than would have been the case otherwise. And with them, at least some of them are going to be carrying this virus.
So every policy decision we make, every pronouncement creates uncertainty. It creates unintended consequences. This is classic.
Exactly.
Classic economics 101. I want to get back. You talked to. We have a habit of talking about Frederic Hayek on this show, and
Yeah.
Not shockingly to the people that watch this show, I think his perspective, and particularly the Austrian perspective, has an important story to tell in the context of economic projections, in the context of COVID mortality projections. And the fundamental Austrian insight is the idea that people act in a world where we don't know what's going to happen next. Hayek and other Austrians call this radical uncertainty about the future. And so much of how we behave and our economic behavior is influenced by trying to figure out how we manage that uncertainty moving forward. And one of the key things of the Austrian critique is that it's very difficult to model human behavior based on assumptions about what happened in the past, because we react to things. We think things through, we solve problems, we make mistakes. And that process itself is what sort of allows humans to advance their condition. how do you apply that to a lot of the science projections, the epidemiologists, particularly I guess Neil Ferguson is the guy, right? And I guess we should explain what that model is and what they projected before we get into using this economic critique to understand what it means and what it doesn't mean.
Yeah, absolutely. So epidemiologists are like most scientists and social scientists. They're modelers. They're forecasters. They're using econometric techniques based on the different data that we have and assumptions about how that data interacts to project what will be the infection rate and what will be the death rate that comes about from the characteristics we know about this disease. And there are some particular tools to epidemiology that are unique to that field, but the general approach to forecasting is something you see across the sciences, the hard sciences, and the social sciences. Everything from economic forecasting, budgeting, public finance, climate science, physics, chemistry, epidemiology, they all use fairly similar techniques to engage in projections into the future based on data that we have. What this does is it allows a typical scientist to generate a model. In epidemiology, the conditions, the steps that go into the model seem to be mostly combinations of the infection rate, what's known about how transmissible a particular disease is, and then also the mortality rate among people that have it. And you can modify some of these assumptions around a bit, but the gist is that you can calculate a forecast based on these known data points that shows how this disease is going to play out over the coming weeks, months, maybe even years into the future. And that's where you start getting these statistics that the politicians are citing, mortality rates. Well, one of the approaches to any type of forecasting across the sciences is that you pick a baseline scenario to go from, and most of the epidemiology models that are getting quoted in the press are using a baseline that asks the question, what if we did absolutely nothing? What if we just stayed the course and let this thing play out and transmit naturally through the population? Well, obviously, that's a pretty bad scenario. That's almost the worst case scenario. And the models that have been put forth, most commonly cited one seems to be this Imperial College model that Neil Ferguson has promoted in the UK, but also extrapolated to the United States. And there are a couple other competitors that come up with the same general gist of a do-nothing scenario. But the short version of it is that's where you get these numbers like 2.2 million deaths in the United States if we just stayed the course and did absolutely nothing. As a scientific exercise, I suppose that's fine to figure out where that is. But what you have to consider in these models when they're using them to make policy advice, you have to start changing the assumptions based on behavior that actually occurs or that you're trying to induce to occur. So the theory behind the models, you take this extreme, probably unrealistic baseline scenario of mass death if we did nothing, and then you start adding in different modifications to it. So what if we do impose social distancing? What if we do go into lockdown? What if there are changes in the way that we approach public health, like washing your hands or using face masks in public? All of these are going to modify the trajectory of the projected infection and death rate. So each different step is itself a modification of the model. So what you find is when you start reading these papers in depth, rather than the quotes that they're telling the media, they'll say 2.2 million as the extreme do-nothing scenario, but they all back down successive steps to much, much milder projections of fatality if certain policies are implemented or even certain behavioral changes are implemented.
Now, as I understand the Ferguson study, the projections of the original paper, which was published, I guess, 2 weeks ago, was anywhere from 20,000 deaths to 2.2 million deaths.
Right.
And that's based on various inputs on the sort of the science side. What is the infection rate? What is the mortality rate? And by the way, those two are mostly conjecture right now because we don't have good data, and I would say as a political guy, anybody that's using data from China is probably using propaganda to do their science. So I sort of suspect that that's not a good place to start on this. But so there's all that uncertainty on that side. So this is all it's not science in the sense. I think Hayek again would warn us about scientism. He warned about it in the social sciences, but this is really a social scientific exercise when we try to project mortality and infection rates on something that we know very little about.
Yeah.
And we're trying to learn, and we're using Italian data, and we're using hopefully we're using South Korean data. We're using propaganda from China, whatever the inputs are. But the other half of this is, and I think this is where the economists at the American Institute for Economic Research, myself, a number of others have said, we're not looking at the changes in human behavior that are going to happen spontaneously because we're self-interested, because we care about our communities, because we don't want this disease to spread. So we're doing things like social distancing. I have voluntarily self-quarantined for quite some time now in my house. Yeah. And they ignore all of that. So
right.
And I think you said this, the moment they put 2.2 million on paper, it was already invalid because people had been responding naturally to changes that made a lot of sense.
Yeah. And we see the evidence of this response all around us. What was the very first thing that happened when coronavirus came onto the horizon as like a legitimate real threat? People rushed to the store and they bought up all the face masks and they bought up all the hand sanitizer. There's a direct economic indicator of two behavioral steps that were being taken by most people just in response to this threat and to mitigate it for themselves. Now, some of those steps have increased. They've intensified over the past few weeks as kind of the changing conditions of the virus are realized as it's come closer to home, so to speak. But people have already violated, I guess, the basic assumptions that would underlie that worst case scenario model. So another comparison I'd use: imagine you have a Category 5 hurricane again coming for a city on the Gulf Coast. It's not realistic to say that everyone in that city would just sit there as if business were usual, go about their day until the hurricane hit. The very fact that they know the hurricane's out in the Gulf and heading toward them induces most people, the vast majority of the public, to change their behavior. So what do? They go down to Home Depot and they buy boards for their windows, or if they're close to the coast, maybe they consider moving inland, fleeing, evacuating the zone that's in threat. This is automatically a behavioral response before government even lifts a finger that most people know if there's a threat out there. Well, the same thing is true of the coronavirus. It would be unrealistic, for example, to project a damage and destruction rate from a hurricane that assumes do nothing when people are already doing something the moment the hurricane is there. The same is true of the coronavirus. As soon as people realize that this is real, this is a threat, that this is there, they do what you and I are doing. We start to shelter in place. I've curtailed and limited the number of times that I go outside, and was doing this long before Ralph Northam or Muriel Bowser or Donald Trump or any politician anywhere was telling me I needed to do this. This is already a natural behavioral response because I'm risk averse and most other people are risk averse. One complication, though, there's always idiots out there, for lack of a better term, that do avoid some of the behavioral recommendations. So, we saw the stories about the spring breakers that were partying a week or two ago as if nothing was happening. And lo and behold, a week later, several of them have come down with coronavirus. The media likes to portray those cases and depict it as if it's the reality, when more often it's just the exception. It's the same as going down to the beach the day before the hurricane hits. You can always find like one or two guys out there surfing in it or something, and pointing to that as, well, people aren't taking this seriously enough. It's anecdotal examples where it seems to be the vast majority of people have already modified their behavior.
Yeah, the presumption that people aren't responsible for their own lives seems a little bit ridiculous to me. I feel like we've managed a really long time to better ourselves and to protect our families without the mayor of DC telling me to do so. My civil libertarian side almost wants to go driving around just to just to prove that I still get to make decisions for myself. And I know someone's going to get mad at me for that, but it's absurd. Well, let's go back to you touched on something that I think is essential here. This sort of we're going to find that poor dumb kid who talked to a reporter on the beach, and that guy he's been more than canceled. I don't know what's happened.
Right. It's been pilloried.
He's probably disappeared at this point. But the media in sort of their natural incentive is to come up with hysterical headlines because they're clickable, and the political class feeds on that. This hysteria seems to have created this policy in the first place, and I think some people have misinterpreted Neil Ferguson's. He did reassess infection rate, as I understand it, but he didn't walk back his original numbers because his original study had a vast number of scenarios. So he didn't walk back the 2.2, but I feel like he was responsible for emphasizing that big number, even though that big number was never a real number.
Right. So if you read the actual study, the Imperial College study, it has a whole range of scenarios. It has the extreme do-nothing model, which is 2.2 million, or the UK version of it, I think, was about 400 to 500,000. So smaller country, but similar drastic death rates. But then the more mild, the more tepid approach to it. These are ones that consider both policy and behavioral responses coming into place, are saying something that seems much more realistic. You're talking tens of thousands instead of multiple millions of fatalities. So that's all there in the original model, and he lays it out why this variation occurs and what are the different policy interventions that he thinks will yield the lower fatality rates. So that's certainly there in the original presentation, and we can critique that. I mean, for example, I'm skeptical on how reliable and how accurate one can be in projecting the effect of different policy decisions on fatality rates for all the reasons we just discussed. There are just too many variables in a complex system, but nonetheless, he does have those scenarios there. At the same time, though, whenever someone from the media calls up Ferguson or some of these other epidemiologists and say, give us your scenarios, tell us what's going on, they seem to only quote the extreme disaster version of the scenario. They only seem to quote the one that says, well, if we do nothing, there are going to be 2.2 million deaths. And next thing you know, that's the headline. Ferguson, unfortunately, and I'm not sure that this was like any malicious design, more so than just being thrust into the media limelight. They're asking for a soundbite quote. And in both the United States and the UK, he gave them the extreme numbers. He gave them the do-nothing scenario of 500,000 dead or 2.2 million dead for the United States if this thing just plays its course. But as we've already discussed, that was unrealistic as a scenario the moment it hit paper, because people have already modified their behavior, let alone to say nothing of the policy decisions that have been made in that time. So I asked the question, is this responsible communication of scientific results if every time the press calls you only give them the disaster scenario? Meanwhile, when your actual scientific work, the papers you're using to model this thing and hopefully trying to put before policymakers for their decision is saying much more milder outcomes are more likely than this extreme scenario you're giving to the press, because the press is going to take that and they're going to drum up hysteria with it, as we've already seen.
Yeah, and President Trump himself, as he originally said, and there's a debate between the trade-offs from those who are strictly worried about containing the virus versus those that are looking at the economic costs and the human lives that would be affected from extreme shutdown scenarios. And Trump has been listening to both those sides. He originally said, we really need to get this economy going by Easter. And now he's walked that back, and he explicitly threw out that 2.2 million death number in the United States to justify that.
Yeah. It's the same one that was all over the headlines. One of the areas where I think I've been more critical of Ferguson than some others is that he was still touting the extreme scenario, the do nothing scenario with 2.2 million deaths, even after many of these shutdown and lockdown policies came into place, and certainly after the social distancing convention came into place. So I do question whether that's a responsible way to communicate with the public. So I think as recently as about March 20th, which is, if you watch your timeline, that's 1 to 2 weeks after most areas of the United States had started to implement various types of shutdown and lockdown, he was still quoting the do nothing scenario to the press. And the press, of course, is running with it.
So one of my friends in the world of cancer treatment told me that some governors have decided in all of these sort of top-down commandments on how we're going to deal with this problem, that chemotherapy treatments and other cancer treatments are now determined to be elective.
Right.
and this gets me to we got about 10 minutes left, and I want to talk about the sort of the economic consequences on lives and mortality of doing the wrong thing, because we haven't focused enough on this. But the idea, I'm a cancer survivor, so the idea that a governor would tell me that treatment for cancer is an elective thing, that's insane.
Right.
That is the most arrogant and arguably deadly thing you could say. So talk a little bit about the economic trade-offs and what are the consequences to human health of these shutdowns?
Yeah, I think there's been an unfortunate tendency, especially in the press, to frame this as a human lives versus the economy type of a trade-off, where on one side you have all these steps that are taken supposedly to protect human lives from this virus, very well-meaning, but certainly that's the claim that's being made. And then on the other hand, they're saying, well, yes, we're giving up economic wealth, we're giving up economic growth in order to protect human lives. But it's actually a much more complicated trade-off between that. It's protecting human lives maybe from the virus with specific policies targeted at that, but we also know that there's an opportunity cost associated with those decisions. There's quite a bit of evidence, even from economic recessions in the past, that they cause spikes in other types of fatalities. They cause suicide rates and depression to go through the roof when people are out of work, out of job, have uncertainty about their income streams for the future. There was, I think, one study after the Great Recession, the financial crisis period, which estimated a radical spike in what they call excess deaths from suicide, just as a response of the economic depression that had set in. So that's one consequence. There are also points of data that have shown and estimated that in previous economic downturns, people defer their treatments on other types of medical illnesses, one of them being cancer. Think about it this way: you lose your job, you also probably lose your health insurance. Maybe that treatment that you were planning for next month to address something that in the long term is going to be very consequential to your health now gets deferred for a few months or even a few years until you're back on a sounder economic footing. So that decision has to be brought into the equation. And what we find is when you start aggregating this together, when you consider it in mass, the effect of people deferring treatments on things like cancer, just basic long-term mitigation of cancer, tends to go up in economic downturns. And the result is that you have higher fatality rates from cancer overall in the long run, even though you may be doing something in the short run that's addressing this very different type of a disease.
So I think of Frederic Bastiat, and one of my favorite quotes from him is a passage in Economic Sophisms where he wonders at the marvel of Paris being fed.
Yeah.
And he's writing in the 1800s, and he's noticing that nobody in Paris seems to care about the fact that if the food doesn't show up on the shelves the next day, people would starve, people would panic, all sorts of really horrible things would happen. And yet somehow, because of market forces and people doing jobs in this distributed division of labor, all of the things that economists write about, that Paris is fed and Paris is sleeping and Paris is safe. When I look at politicians dismissing or ignoring the economic consequences of their action, or deciding which job is essential versus which job is non-essential. I think they're working from a radical ignorance of understanding this distributed division of labor. Yes, people that deliver food to your door are essential. Yes, grocery stores are essential. Yes, pharmacies are essential. But what about that infinite number of people and functions and companies and workers that support all the things that make sure that all those things happen? And this is something that I don't think Americans think about at all, because food magically shows up, our iPhones magically show up. But we are seeing in countries like India, Modi has taken a radical shutdown approach, and there is no social safety net. There is no means for poor people in India to feed themselves if they're not allowed out to work. So in this case, it's an extreme case, but in this case, economic shutdowns mean people starving to death.
Right, right. It's a focus upon, to borrow again from Bastiat, that which is seen, and what is seen is the virus, what is seen as this pandemic threat, to the neglect of what is unseen. And what is unseen is often a product of the case of our human condition of ignorance. It's impossible to understand and coordinate and fully decipher all of the economic activities that are happening at any one moment. So there's a very radical presumption that's almost being adopted as policy when you enact a shutdown. You're saying that I, as governor of the state or mayor of the city, know what is essential. I know what is necessary and what is not. And I can easily categorize. I can parse society into essential things, which may be food delivery, medicine, and pharmacies, and then non-essential things, which is everything else. Add to that the enforcement arm of the state, giving police the power to pull people over at the border on the highway stop, or giving police the power to disperse someone who's in public for the wrong reason. That's an assumption of knowledge that the state itself is very ill-suited to even comprehend or possess. An average policeman has no idea why a person walking down the street at random is out there. It could be maybe they're going on a jog or a joyride or something, or maybe they're in an urgent rush to get to a relative's house because they need to take them to a doctor's office. But that's only known to the person themselves that's traveling. When you start enacting these blanket policies, you are taking that element of knowledge out of the decision and presuming it on behalf of the state that there are easily parsed and discernible reasons to even be out and about. So one of the problems that comes about with any of these shutdown policies is they tend to veer toward uniform, one-size-fits-all approaches to economic behavior of what's permissible and what's not permissible. But one-size-fits-all very, very seldom mirrors what's actually happening in society. And that's just an open recipe, an open invitation to make decisions that unintentionally, and possibly even out of the best motives of reasons of stopping the coronavirus, but they unintentionally stop people from doing things that end up being actually very essential to their well-being, to their health, to their safety in a time of pandemic.
Right. What a perfect way to close out this interview. Encourage everybody to take the responsibility to get schooled up on all of this stuff. I think we all need to know more. The intellectual division of labor, unfortunate, before our eyes as politicians sort of do all of these things. And the American Institute for Economic Research has just published a book. It's amazing that you guys felt content to publish a book on the economic consequences of the coronavirus. Tell us about that, and tell us about where people can find out more about the research that you guys are working on right now.
Right, right. So one of the unintended effects of being in lockdown for the past several weeks is we all have time to sit around in front of a computer and research and write. So just yesterday, AIER released a book called Coronavirus and the Economic Crisis. It's edited by my colleague Pete Earle and contains just an assortment of all of our essays, thematically arranged, exploring all the different policy and economic dimensions of this crisis as it unfolds. So we put it together over the last few weeks, just released it yesterday. You can get it on Amazon, although I checked a few hours ago and they were already backlogged for it. So it's taking off to kind of a surprise bestseller, which we think is good because a lot of people are sitting around at home trying to find information. They're starved for information about how to navigate not just the disease itself, but the likely policy and economic consequences of the disease. So what we're trying to do is offer a foray into that conversation to draw attention to economic issues and opportunity costs and unintended consequences that many of the media, pundit class, and politicians are not paying too much attention to, and offer that as a way to contextualize how we navigate this crisis together.
Did I just hear you say that people are hoarding AIER content like toilet paper right now?
That seems to be the case. Hopefully, they're using it for other reasons, but they're it's been a very sudden, sharp, almost unanticipated, unexpected surge of interest in this particular book. So I take that as a sign that people are starved for information, and they're looking for reasonable, intelligent commentary, not to tell them what to do during the crisis, but to help them consider what some of the effects are and contextualize it in a rational way that they can better understand what's unfolding around us, and hopefully put some more prudent brakes on some of the excesses of the political and media class.
I, for one, have always had more faith in the wisdom of crowds and of free people to figure out problems than sort of ceding all of that decision making to an expert, particularly one with unfettered power. Thank you, Phil Magness, and please be safe out there and keep doing what you're doing.
Thanks again.
Thanks for watching Kibbe on Liberty. By now, you know this is the most important event of your week. So make sure you subscribe on YouTube. Click the little bell so you get notifications. Kibbe on Liberty, mostly honest conversations with mostly interesting people.